Hi there, guys. So my name is Quentin Lewick. I'm a Port Washington High School graduate of 2014.
Then my name's Killian Mielatz. I'm a Grafton grad of 2014.
And my name is Jacob Kaufman, and I'm an Edgerton grad from 2014. It's down between Janesville and Madison.
Yep. So we are giving a presentation for your class. We were originally supposed to come in thanks to Miss Nan, but unfortunately with the circumstances, we had to create a video or electronic or virtual presentation. We're going to try and make it a little more brief just because a lot of our material is more interactive. So hopefully it only should be about like 15, 20 minutes. And then we do have a quick survey monkey at the end for you guys to fill out for us. That's just to help us out with our presentation. And just so you know where we're from, we are all currently in our third year of pharmacy school at Concordia University, Wisconsin. We will be graduating next year. So we're going to be going over essentially the safety of all medications, and then more specifically, we're focusing on a specific type of medication called opioids. So first, obviously, a little more interactive question, but who has had a medication before or had medicine before? Pretty sure 100% of us have had at least some sort of medication since we've been born. Whether it's like the pink amoxicillin that you see there, that brings back memories, but it's a very common thing that people experience. But a lot of people do not know that much about medications, so that's why we are kind of giving a little brief background behind them. So what is medicine, or what is a medication? So essentially it's practicing diagnosis, so figuring out what's wrong, treating it, and then preventing in the future. Essentially, a more basic definition is it makes you feel better, or it stops you from feeling bad in the first place. So why are we talking about medicine and medications? Most time you think that they're good, right? Obviously, sometimes they can also be bad. So who knows what the medications look like? I know we all know they can look at like different forms. They can look at capsule, tablet, or even liquids. But with that, a lot of medications can look like other things, like candy. So just take a quick like moment or two, look at A, B, C, D, and E. Only one of these is a medication. Which one do you think is the medication? I'll give you like 5 seconds to decide your guess, and then we'll reveal which one is. And then you can also pause the video too. But I'm assuming that after you pause the video, we can come back now. So the first one, B was an M&M. So if you guys B, not quite right. E was a Milk Dud. C was a Skittle. So now it's down to A and D. D was a Sweet Tart, and A was the actual medication called an iron medication, or iron. So like I said, a lot of medications can look like candy and not look like itself. So it can be dangerous when you have medications at home. So with the dangers of medications, it usually is used to make you feel better. But like I said, if you take something that looks like candy and you didn't know, it can cause some side effects and make you actually more sick. So how does that exactly happen? So side effects are the main reason of causing you to feel more sick. So normally, if anyone's had like a medication, it's supposed to do one thing, supposed to work there, and then you're supposed to feel better, but it can also cause some side effects. I like to think of it as like a lock and key method. So if you have like a headache, and if your parents have taken Tylenol before, you take the Tylenol, it helps with the headache. So essentially your brain has like little locks on it, and the medication's like a key. The medication goes, unlocks the lock that is causing the headache, gets rid of the headache. So with that being said, if you've ever had ibuprofen before, you usually use it for if you have like some sort of sprain or inflammation, or if you're having some pain. So when you take the medication, it'll go to that site, like your ankle or your arm if you're experiencing any pain, and it'll unlock the lock and make it feel better. But then there are also locks at other parts, such as your stomach. So ibuprofen also goes to your stomach, can unlock the lock, and also cause a stomach ache. So that's kind of how side effects happen. There aren't just locks at the one place that you want the medication to work. They're kind of all over your body. So that's why side effects happen. So those are some easier definitions, or medications that might not cause as much harm, more of like a stomach ache. There are other medications that are more dangerous. So today we're going to be going over opioids a little bit more. in depth. And then we can all, there are other medications called benzodiazepines. Those are usually used for mood. Those can be very, very dangerous and cause something called respiratory depression, which is essentially stopping you from breathing. We'll go into much more depth on that later in the presentation. So essentially this first part was just to briefly give like background information so we can go in more depth with the second half of the presentation. So for just the takeaway message, if you find medication or anything that looks like candy on the ground, obviously don't eat it. Tell an adult, or if it looks more like a medication, give it to an adult, like a parent or a teacher. And then just make sure you're awake. Quick question: which of the following is a side effect of ibuprofen? You can either go back in the video to the previous slide, or just try to think it through. I'll let you pause it here and then try to figure out the answer, and then I'll give you a couple seconds. And then we're back from being paused. So the right answer was B, upset stomach. That was the main one that I talked about. So part 2 is opioids. I'll let Killian and Jacob take that from here.
All right. So guys, you just got done talking with Quentin about medications in general. So next we'll talk about opioids and the opioid epidemic. So I just want to give a little bit of background about the opioid epidemic. So back in the late 1990s, pharmaceutical companies were reassuring the medical community that patients would not become addicted to opioid pain relievers. And then healthcare providers were beginning to prescribe these opioids more often and at greater rates. So these increased prescriptions of opioids led to widespread misuse of the prescription and non-prescription opioids, which then led to the opioid epidemic. So as you can see, from 1999 to 2017, over 700,000 people died from drug overdose, and around 68% or more of the 70,000 drug overdoses were involved using opioids. So I just want to give you guys a picture. So Milwaukee, it's a pretty big city. There are over 600,000 people in Milwaukee. So imagine from 1999 to 2017, all the people in Milwaukee are gone, plus an additional 100,000 people. So it's a pretty scary thing that's been happening with the opioid epidemic. A lot of people have been affected by it, especially the Midwest. There have been quite a big percentage of people that have been affected by the opioid epidemic. It's not from just the prescription opioids. There's been seen that you transition from prescription opioids over to heroin due to having access to it. And that's all because of the start of the 1990s, reassuring that patients wouldn't get addicted to prescription opioids. All right. So what are these prescription opioids that I'm talking about? We'll go to the next slide and we'll just give some examples of what they are. So they are a class of medications that help with pain relief. The examples are Oxycontin, fentanyl, morphine, heroin, and many more. Some of you might have, if you've had your wisdom teeth taken out, might have taken hydrocodone or Percocet, maybe Vicodin. So those are prescription opioids and they help with the pain. And one of the very dangerous side effects that can happen is tolerance from those pain medications. So some people, they need to take the opioids for chronic pain, or if you have your wisdom teeth out, it's just for a short time. But if you continue taking those opioids, your body gets used to it and it leads to tolerance. So on the next slide, we can talk about what tolerance is. All right, so tolerance, per the National Institute of Drug Abuse, is a state in which the organism is no longer has a response to the drug, so you need a higher amount for it to have a response. So people who take the opioids for a long time, after taking one tablet for a while, they don't feel that same pain relief, so they'll take 2 tablets to keep the pain relief. And then over time, they keep building it up because their bodies just keeps getting used to it. And so let's talk about how opioids actually work. So in your body, you have these receptors called mu-opioid receptors, and the opioids are opioid receptor agonists. So they act to work on the mu-opioid receptors. So the drug attaches to the receptor and causes something to happen. So in this case, the opioid's attached to the receptor, and then the signal in the brain is sent and it's blocked, so then you don't have that pain. So we'll just go over what the pain signaling is. So at the hand, you can see these nociceptors. So these nociceptors at the hand, they process pain, so you can feel pain, which in some cases, it's a defense mechanism so that if you're in danger, you don't hurt yourself even more. So we'll just give a tiny example, which everybody probably has happened to them. You stub your toe on a bookshelf or something, and then you feel sharp pain go from the toe to your spinal cord, up to your brain, and then you feel that sharp, stinging pain. So that is the whole pain process that is happening. When you take an opioid, it actually stops that pain from going up to the brain, and then you don't feel that pain anymore. So that's the biggest thing with the opioids. They stop that pain, and they also make people feel good because the pain is no longer there. So that's why one of the things is that you can have people become addicted to it because you don't have that pain anymore, and it causes people to feel good. So that's one of the dangerous side effects of opioids is the addiction. But more common side effects with the opioids is that it can cause drowsiness, nausea, and constipation. And then earlier, Quentin brought up that benzodiazepines can cause a thing called respiratory depression. Opioids can do the exact same thing. So we'll talk about that next. So respiratory depression is when you have decreased signals sent from the brain to all parts of the body, and specifically targeting the lungs and the muscles in the lungs that cause you to breathe. So with the opioid receptors, the new opioid receptors, your brain thinks, oh, I can just shut down and chill out for a little bit so I don't need to function as well. And then this will cause the lung muscles telling your brain, oh, I don't need to breathe. And then over time, your body just stops breathing. And then this can be quite fatal if your body's saying, oh, I don't need to breathe. I can just chill out for a second. So this would be if you stop breathing, this would be cause a overdose, and it can be very fatal. So then we'll let Jacob talk about when this is more likely to happen.
Yeah, so this is something that can happen when you're taking an opioid or another medication that can cause a side effect like this respiratory depression that Killian talked about. When you're taking that's meant for someone else, when you're not actually supposed to be taking this medicine, or when you mix it with other things. So Killian and Quentin both talked about benzodiazepines. So that's a common medication for anxiety like lorazepam or Xanax or something like that. This is also more likely to happen when you mix it with alcohol. And if you're taking a prescription opioid, if you're taking it more often than you're supposed to, even if it is something that your doctor said you can take, so say they say you can take 1 to 2 tablets, if you take 2 tablets all of the time, this could mean you're at a higher risk for this respiratory depression to happen. But the good news for this is there is an antidote for this respiratory depression, and that is called naloxone or Narcan. So what this is it's a medicine that works against opioids to help prevent these side effects from happening if someone is to have an overdose. And the way that this works is it acts on that same receptor that Killian talked about, that mu opioid receptor, but this one works to block that receptor so that the opioids can't attach to it like they normally would. And then we do have a video about how we can use this. We're going to bring in a few of these devices and let you guys play with them a little bit, but obviously that's not going to be able to happen. So we're going to queue up this video. It doesn't have any audio, but we're going to talk through the different steps. So there are 4 different types of the naloxone, but we're just going to talk about one of them, and that is that Narcan, the nasal spray. So basically how you use this one is you're going to open the package and you'll peel back that adhesive that keeps it shut. And then you're going to hold the device how it's shown there. You're going to put your thumb on the bottom and your 2 fingers on either side of that nozzle. And then you're going to put the tip of the nozzle into either one of your nostrils. And then you're going to push it all the way up into the nose until your fingers touch the base of the nose. and then press down on that plunger with your thumb. And that's going to administer the dose of that naloxone, the nasal spray. So some ways to dispose of opioids or any other medications really that you're not using any longer. We can talk about a few of those different ways. The reasons that you would be getting rid of these is just so that it's not available for other people, family or friends, or anyone who may be able to get into it. It's not available for them to use or misuse. We can also get rid of them when there's no longer a reason for you to be prescribed them. So say you have an antibiotic and after a week, your doctor says, stop taking that one, but you still have a few days left of it. That would be a reason that you could dispose of the rest of that medication. There's a few different sites that you can dispose of medications at, and we will get into that on the next slide. There are also something called Dispose RX powder, and I know that this is available at Walmart, but basically what it is it's a powder that you mix with water and then your medications, and it kind of binds them all up so that it's not usable anymore. And then another common way, if you're not able to get to one of these sites to dispose it, or you're not able to get a hold of this Dispose RX powder, would just be to mix the medications with something that people don't want to get into, like coffee grounds or cat litter, or something that would distract people from wanting to take these medications even when you've thrown them out. So a couple of the different places to dispose of medication in Ozaukee County here. One of them is drug take-back days, and those are offered, I think, twice a year. The next one coming up is Saturday, April 25th, and you can go either to the Ozaukee County Transit Center, or you can go to the pharmacy school at Concordia University, and we will be able to take those medications back and dispose of them properly that way. So if you or your family has medications that they're looking to get rid of that maybe they don't have a need for anymore, or it's just been sitting around the house for a while and nobody's needing it, you can definitely encourage them to bring it into one of those med take-back days, and we can dispose of it properly there. There are some other drop box locations where you can bring your medications and just drop them off and they will be disposed of properly. And those are all listed down below there. So the most common one is at different police departments. So just some things that we want you to take home, like some messages from our presentation here, is first and foremost, don't take an opioid unless it's prescribed to you by a doctor. We don't want to be taking medications that aren't ours. And then even if a doctor does prescribe it, I think Killian mentioned, like if you get your wisdom teeth taken out, you could be prescribed an opioid for the pain after that, but still take it with caution. Even if you're taking it how you're supposed to, there's still the possibility of these bad side effects that we've been talking about, and we want to avoid that if at all possible. Opioids are addictive, and they are dangerous even when you're taking them as prescribed. So it's good to just be an advocate for medication safety, talk to family, friends about some of the things you've learned about this presentation, just so that they're aware of some of these serious side effects that could happen. I know we're not really in person here, so there's not really the option for you to ask questions directly to us, but if you do have any questions about anything that we've went over in this presentation, please reach out to one of your teachers. They can get a hold of us and we'll be happy to answer any questions that you guys have about that. And then we do have one more question that we wanted to ask you guys about, just to double check that you've stuck with us this far. So our question is, what is the receptor that opioids bind to? And then also, this is the same receptor that Narcan or naloxone binds to help reverse the potential overdose. So we'll give you a few seconds here to think about that answer, or pause your video if you need to. All right, so coming back, the answer to this question would be D, the mu opioid receptor. And then I think, like Quentin mentioned in the beginning, we do have a Survey Monkey, so we would really, really appreciate it if you guys would take a few minutes to fill that out. We will be sending out that link to you guys, and then this will just help us with our project or our presentation for the class that we need to. All right, thanks all for all of your attention today. Have a good rest of your day.